So the communication is about to listen to understand and speak to explain. Okay, if you're listening to try to listen if you want to understand them, and if you're speaking, try to speak them if you are explaining them. It is not just about the reading a newspaper or reading the news. Okay, and don't listen to give answer. Try to listen to know their concern. What is their concern? So basically, communication skill can be divided the six pattern: information giving, breaking bad news, consent, critical incidents thinking, ethics, and education. Information giving. Next one. Check the parents' understanding of their child's current. See that it a consent. If you are giving a consent, taking any consent for any procedure, to check the parents' understanding. If you want to do lumbar puncture, tell them what is a lumbar puncture, why it is important, what if we do it, what if we don't do that. Ask them the question, whatever speaking, whatever uh, we are giving them information, the understanding. Explain them how the procedure done, whether there is any requirement of anesthesia or not, how it is done, and what could be a possible outcome. It may be successful procedure, it may be a failure procedure. Any risk like infection, bleeding, failure of the procedure, and what are the risk versus benefit ratio that we are taking risk of the procedure or not. Is an alternative available or not? Ask them to ask the question, address them one by one, and at the end of the time, be empathic, be sympathetic, uh, give them appropriate information, whatever they want. And then the last, you need to summarize whatever is in the shorts and check the understanding again. And take a signature, written consent regarding the document. This is more important. Okay. So some example like please take a consent for lumbar puncture of unsuspected or meningitis. So you can try to role play. One can become a parent and one can become a doctor. Like take a consent for renal biopsy of the 4-year-old boy with a complicated nephrotic syndrome. So in the nephrotic syndrome complicated, we need to take a biopsy. So we need to take a consent. Take a consent for the active suggestion for the CT scan of the 3-year-old girl. Because young kids don't sleep in the CT scan MRI. So we need to keep them uh, silent or still while they are having CT scan. So that's why we need to give them some sort of sleep medicine. Consent from the parents of the newborn baby on the ventilator. Sometimes a newborn baby, we need to admit the baby in the NICU and we need lots of procedure immediately. So the new parents, because mom is in labor pain, dad is maybe here and there. So it is our duty to explain them in such situation in empathic way for the consent. A consent from the parents, test of the if the mother is positive HIV and child is positive, the how and if you want to do the child is HIV test, so we need to ask for the consent. So there are also example, but that is how consent works. So whenever ideal in this that explaining new treatment, sometimes we want to change the treatment to tell them how why we are changing the treatment, what is the reason for it, how this will work, how it will be administered, what can be technique, what can be possible side effect, why it is, why not there. If they want to take a time, they want to think to change the treatment, then give them time to think. If not emergency, invented question, give them written informations, meet again. Because if you start the treatment without their consent, okay, without that, without their, um, what I said, without their willingness, they won't be able to continue treatment, and there will be a question of compliance. So that is the thing. Okay. So next one. Next one.
But it's there on the screen, examples.
Yeah. I'm not seeing that anything sitting on the screen.
It's not there on the screen, doctor.
Yes, not shared.
Is it visible now, doctor?
1 minute. Huh? Yeah, tell me. Yeah, yeah. So that is that example that we don't need antibiotics. Some dengue is very common in India, and some parents asking to start the antibiotic in dengue fever. You need to explain that dengue is a viral fever. We don't start antibiotic in the dengue fever. Sometimes we said the ITPs, immune thrombocytopenia, where sometimes we don't need to do platelet transfusion because it may be a counterproductive. When parents ask, can't we transfer the platelet? So you tell them it is not effective. What is your perception? It is okay. Now, explain the parents of a 2-year-old boy with the uncontrollable epilepsy and the possible epileptic. So that is also important.